Hello, everyone. Welcome to another edition of the OrthoCarolina's monthly webinar series. My name is Dr. Justin Rennard. I'm an orthopedic foot and ankle surgeon here in Charlotte, and we're going to be talking about bunions and bunion surgery today. This is being live streamed on our Facebook, LinkedIn, and YouTube platforms. And if you'll save your questions for the end, I'll get to them after we finish kind of this little brief educational session. So let's get started. So again, a little bit about me. Again, my name is Justin Rennard. I'm an orthopedic surgeon who did a subspecialty training in foot and ankle surgery. Did my undergraduate training here in University of Missouri in Columbia. Went to medical school at St. George's University, and then followed that up with residency at the University of Texas in Houston. And then I finished with my fellowship in foot and ankle surgery here in Charlotte, North Carolina at the OrthoCarolina Foot and Ankle Institute. So today we're going to be talking about bunions and bunion surgery. It's a pretty common topic, but we'll go through this as a brief outline, and we'll talk about diagnosis, risk factors, management in terms of non-surgical and surgical treatments, and then the recovery from either one of those treatments. And then we'll have time for some questions here at the end to talk about kind of the things that we're going to go through. So to start off, what is a bunion? The medical kind of fancy term for a bunion is hallux valgus. Essentially what it is it's drifting of the big toe towards the smaller toes, commonly that leads to pain over the bump that develops on the inside part of the foot. You can develop pain in other parts of the foot secondary to a bunion or because of a bunion, things like a crossover toe or pain on the ball of the foot, inability to wear shoes. These are all things that can happen, but the bunion itself, the term bunion basically just means that your big toe is drifting towards your smaller toes. And so this is kind of a picture of that, kind of describing it. So the bones in the foot, the bones kind of behind your toes or in your foot more, we call them metatarsals, and then the bones in your toes are called the phalanges or a phalanx. And so we call that joint that forms the bunion the metatarsophalangeal joint. It's basically just combining of those two words, and it's the joint in between. And so you get a painful swelling over time as the big toe drifts towards the smaller toes. And that joint can then get inflamed and swollen and irritated and can eventually potentially cause pain in the other toes. It is more common in women than in men. It's hereditary, and not all of them are painful. So some people develop a bunion, they notice that their big toe is swollen or it's drifting to the other toes, but it doesn't bother them at all. They wear their normal shoes. It doesn't necessarily cause pain, but some of them are symptomatic, and those are the ones that we talk about treatment. In terms of what happens to them kind of naturally, they do naturally just progress over time. As we age, gravity kind of always wins and our foot gets a little bit flatter. So people with a high arch get a little bit of a more normal arch foot. People with a flat foot usually will get a little bit flatter over time. And the bunion will usually progress a little bit over time. It's hard to predict how fast that will happen, but it does generally happen over time. So symptoms of a bunion that do cause pain. So the symptomatic bunion, you can get basically these couple of things that we talk about. So pain over the big toe, right at that kind of red spot where you see on that picture. You can get some swelling. You can get pain in the lesser toes from where they may rub on your shoes or cross over the big toe as the toes get more crowded. You can develop some calluses or skin changes, which can eventually lead to ulcers. And you can also develop some difficulty with shoe wear. So all of these things can happen because of a bunion. They don't necessarily have to happen. You can have a very wide foot with a toe that points towards the other toes and have none of these things, or you can have all of them. So it just kind of depends on the person and how you develop as time goes on. In general, there's a couple stages of a bunion. This is kind of a good picture that I like to show to patients as we progress. You know, they say, oh, I have a terrible bunion, and they'll come in and it'll look like the picture on the left. And then I'll show them this picture and they'll be like, oh, wow, that really is a bad bunion on the right. And so you can see the progression as you go from mild to severe, the changes in the other parts of the foot. So the bump gets bigger, the toes start to cross over, you can develop hammer toes and things like that. And there's a different varying stages of symptomatology associated with these stages. So when you come into the office, if you come to see me to evaluate your bunion, you know, I'll first talk to you about, you know, questions related to how long it's been going on, how long you've had it, how long has it caused you problems. We'll do a quick physical exam and we'll evaluate the range of motion of your big toe, the range of motion of other parts of your foot, the alignment of your foot. We'll have you get some standing. We'll have you stand up in the office with no shoes on, and evaluate your arches. We'll look at, kind of the sensation and look at the muscle strength of your foot. And then we'll obtain some x-rays. And usually we get some weight-bearing x-rays, people standing up, and get x-rays of you while you're in the office, just to see, the bony architecture of the foot. And once you do all those things, you'll come back into the room and we'll kind of chit chat with you about, kind of what type of symptoms you have and how much they bother you and how long they've been bothering you for, and what you're willing to do about those things. And so sometimes that involves surgery and sometimes it doesn't. And we'll kind of go through that process as we kind of go through the rest of this little brief talk. So treatment options, there's a lot of easy things you can do for bunions that develop, changing your shoes, taking an anti-inflammatory, things like Advil, Aleve. We can prescribe anti-inflammatories, stretching out your shoes, wearing shoes with a wide toe box. Sometimes people use silicone toe caps. You'll see all sorts of things on the internet about orthotics that you can wear for bunions, and we'll talk about those a little bit. But there are a bunch of what we would say conservative measures for bunion treatment. And so if you can find a pair of shoes that fits well and doesn't rub on your bunion, then you can continue to live your life and do all your activities. That's one thing I say in the clinic a lot is I can't fix pain-free, and if a pair of shoes is going to make you pain-free, I can't make that much better. And so these are kind of the simple things we can do for bunions, shoe inserts, and wide shoes to help alleviate some of those treatments. So bunion splints, this is just a screenshot of, if you Google bunion splints, the different kinds of things you'll see on the internet. Some people, and there is some data to support that these alleviate symptoms while you're wearing the toe splint or the bunion splint, but there's no data to support that wearing these will prevent a bunion from recurring or prevent it from getting worse. It's all very mixed in the literature, and so you can wear these if they're comfortable for you and if you like them, but generally I don't recommend that patients wear these unless they find them to be extremely comfortable. The kind of previous slide that we talked about, wider shoes or shoe inserts is kind of where we start. These things are, if you like them, you can use them. They're not necessarily going to hurt you. So if you do all of those things and do all the things we talked about in terms of non-operative management, things that we talked about in terms of anti-inflammatories and shoe inserts and stuff, and that doesn't help your pain get any better, and you're still having pain, your lesser toes are hurting or the bump is hurting, we will talk about surgical options to fix a bunion. We'll go through that a lot here in the next few slides, but it is important to recommend that if you have a deformity but no pain, we generally don't recommend operating on those individuals. And that is because if you're pain-free and you're doing all the activities you want to do and you don't hurt, a cosmetic surgery for your foot is not recommended because it may hurt after surgery. And I want you to be as pain-free and as active as you can be, and I don't want to cause you pain. And so surgery in people who don't hurt is not generally recommended. So types of surgery for bunion, we'll talk about that. If you do continue to have pain like we talked about, and you've tried these conservative things and nothing's working, and you've kind of gone through the whole process of getting evaluated for a bunion, and it's time to kind of talk about surgery for it, there are basically two types of overarching themes that we can do for bunions. One of them is a joint sparing procedure where we kind of realign the bones and don't necessarily fuse any joints. And then the other one is a joint sacrificing procedure where we'll realign the bones, but we'll also fuse joints in the process. There's a bunch of different ways to fix a bunion, and there are a variety of methods and treatment algorithms. We'll talk about some of them kind of in an overview. For a more detailed view, we'll probably save that for a more clinic visit and in-person discussion. But every bunion has a specific operation that is probably best for that bunion, and you can ask a variety of orthopedic surgeons how to fix a specific bunion, and they may give you different answers. And so there's a variety of ways to fix each one, and each one is tailored specific to each patient. So just a quick overview, but these are three quick options in terms of fusing or fixing a bunion without fusing a joint. So on the far left picture, you'll see there's a little bit of a crossover toe on the furthest left picture. And then if you go to the next picture over, the one with the white implant on it, it's a plate and screws. That joint is now fused. So that fuses the bunion, but it fixes the the problem. So the toe is now straight. The second toe is no longer crossing over that toe. Sometimes we need to do additional procedures when we do a bunion surgery, and in this case, they had some procedures to the lesser toes to help keep them all straight and well aligned. But this is an example of a fusion type procedure. There is a way to fix the bunion, like we talked about in the previous slide, where you don't fuse the joint, and that's the middle slide there. You'll see on the middle left picture where the bunion is present, and then just to the right of that with the one screw in that piece, or in that big toe. We shave off the bump and cut and shift that end of that metatarsal bone and shift it over towards the lesser toes to straighten out the bunion. And if you look at the alignment between the base of the foot, or the bottom part of the image, and the toe, you can see that the toe is now back straight. You can do that as well if you look at the far right picture through what we call a minimally invasive technique. That's abbreviated MIS. So it's minimally invasive surgery. That's with smaller incisions and using a burr. It's just a different technique, but it's the same basic idea, where you cut and shift the bone and rotate the bone at the end, or the metatarsal head, to make that toe again straight, and gets rid of the bump. There's benefits to each one of these different operations. For a fusion procedure, if you have arthritis in the big toe or something like that, it's usually recommended for a fusion. If you have some soft tissue work that we may need to do, an open procedure may be recommended. And then there are circumstances where minimally invasive techniques can be utilized, and those can help decrease swelling and improve recovery time and things like that. So like I said, every patient has a different bunion, and every patient requires a different bunion surgery. So we would talk through those when you come into the office and talk about the options for what we can do. Now, if you Google bunions and you Google bunion surgery, one thing you'll find online as well is something called Lapiplasty. Lapiplasty is a brand name of a type of procedure called a Lapidus procedure. A lot of people come in and will say, hey, I want that Lapiplasty procedure. I have a bunion and I was told that'll fix it. And while that may be true, it's not always true. And so Lapiplasty is a device name. It's a type of implant, and it utilizes some guides and cutting jigs that are unique to that brand. But there are other versions of what we call Lapidus procedure. And so you can see the pictures on the left and the pictures on the right. Those are a different plate and screw configuration, but the one on the left is a Lapiplasty and the other one on the right is a Lapidus. They are both Lapidus procedures. Lapiplasty is just the name of the brand that markets this particular procedure. And that can sometimes also be the type of procedure that you may need to fix your bunion. It is not always the type of procedure that you need to fix your bunion. So a Lapiplasty or Lapidus is not necessarily the procedure that you will need, and we'll talk about all the options. Like I said, when you come into the office, we'll talk about, pros and cons of each one, and we'll end up settling on something as we talk about the surgeries together. Ultimately, like I said, if surgery is needed, we'll discuss all of these different options, their recovery rates, risks and benefits and things like that, and choose the one that's best for you, and choose the timing of surgery based on when you are ready for proceeding with a surgical intervention. When we talk about the surgery, just in general, it's a same-day surgery. So you come in as an outpatient. You'll come in and go home on the same day. This isn't an overnight recovery. The recovery process will depend on what type of surgery you have. So a fusion procedure or a joint-sparing bunion procedure, in general, you'll be able to heel weight bear right away, meaning you can walk on your heel the same day from surgery. You'll get a special dressing and a couple different things, which we'll talk about kind of in detail. But for the most part, it's important to know that you essentially are able to walk relatively quickly after a more what we call a forefoot procedure, or working more towards the toes. When we do something more towards the midfoot or more in the middle part of the foot, like a Lapidus or Lapiplasty procedure, in general, we keep you off of that where you're non-weight bearing for a few weeks. And so again, there's pros and cons to each one, but we would talk about those when you come to the office. This would be an example of let's just say that the fusion procedure. So on day one, you can walk on your heel. You can't put any weight on the ball of your foot. You come back and see me at a week. We'll take a look at your incisions, make sure everything's going okay. And then at week 4, you get to walk normally heel toe, but you're still in a stiff-soled kind of surgical shoe. So the surgical shoe is something we would provide you in the office. You've seen a bunch of these probably on online or in places where you see these blue surgical sandals, or they can be any color. But we provide that for you in the office, and you wear that for about 6 weeks after surgery. You'll transition then to a regular shoe as your swelling allows at week 6. And at about week 10 to 12, you start to feel like you're back to normal. The biggest thing from a recovery standpoint for bunions and bunion surgery is the swelling. People are always complaining about the swelling. The swelling is the last thing to go away, and it's the most frustrating. It's not necessarily problematic. Sometimes swelling is problematic that we need to address, but most of the time it's just frustrating and doesn't go away. It lingers around for a long time. And it's because the foot is the most dependent thing we have. We walk on our feet. Gravity always wins, and it pulls more blood. So the more you can elevate your foot, the more you can help the swelling. And the more you can help the swelling, it helps your pain, things like that. But it is always frustrating for patients to have swelling, and it does and can sometimes last for 4 to 6 months. So expecting that before you go into surgery will help you with kind of the recovery process. Now, it wouldn't be appropriate to talk about all this, not talk about the risks and complications associated with bunion surgery. They're pretty much the same as with any surgery. So anytime we make a cut in the skin, there's a chance that you'll get a wound complication, an infection. If the bones don't heal together, whether we cut the bones or trying to fuse 2 bones together or trying to fuse a joint, sometimes those don't heal, and that's called a non-union or a malunion if they don't unite all the way or they unite in the incorrect alignment. And sometimes we need to go in and correct them. And then recurrence. Recurrence is not super common, but it does happen, particularly with joint sparing procedures where we do save your joints and save your range of motion. So if your bunion over time, you had one done 20 years ago and then you recur, it's a low likelihood, but it can happen where you'll get a slight recurrence of your bunion over time. If that happens, we can always address it as we need to. It is important to know that this surgery is an elective procedure. So you'll come in, and if you are a bad diabetic or you're smoking or you have other risk factors that we can control for, we always want to try and control for those as much as we can so that you have a good outcome from your bunion surgery. Because the last thing I want for patients is for them to come in, see me, talk about a bunion, we decide to operate on them, and then they have a bad outcome. And so if we can do whatever we can to make sure that you have a great outcome and that after surgery is over and after you've recovered and you're back into a shoe, your foot doesn't hurt and your bunion's fixed, that's the kind of best thing and kind of what we strive for. And so quitting smoking, getting your diabetes under control, making sure that we're all checking our boxes and making sure we're crossing our T's and dotting our I's to help you have the best outcome possible is something that we'll do. And so if that means we need to delay your bunion surgery, we'll delay it until we can do those things. So in summary, just kind of quick overview of what we talked about. Again, bunions, they're progressive. They can sometimes cause pain. They don't always cause pain, but there's not necessarily anything we can do about them. They will kind of continue to progress over time, regardless of, activity modifications or PT. It's about treating the symptoms. They can be treated with or without surgery. So without surgery, it's shoe wear modification, activity modification, anti-inflammatory medicines, Advil, Aleve, things like that. And then surgery. So if those things don't work, the shoe modifications, the silicone toe caps, that kind of stuff doesn't help you, then we'll talk about surgery. And like I said, there's many different options for what surgery is best for you, which we'll talk about in detail when you come into the office and we start going through that. Through recovery, it can be kind of long if we're talking about doing a multiple fusion procedure where we're fusing some bones in the midfoot, but I will be there the whole time. You'll come back and see me as much as you need to. We'll take kind of great care of you the whole time if you need it. And if you have any problems throughout the process of recovery, we'll be there to kind of see you in the office or go through things as we need to. That's pretty much it. So we'll open it up for questions at this stage. And I'm happy to kind of answer anything I can. The first question here is bunion surgery the same as Lapiplasty surgery? So yes. Yes and no is, I guess, a better way to answer that question. So bunion surgery, Lapiplasty is a surgery where they fuse the 2 joints. It's called a TMT fusion or a tarsometatarsal fusion. It's fusing the joint above where the toe is pointed in the wrong direction. So it's not fusing the big toe, it's fusing the joint above that. You can do a Lapiplasty procedure for other things other than a bunion, but in general, it's marketed as a bunion type surgery. So they realign the metatarsal with that surgery. So Lapiplasty or Lapidus is a type of procedure that can be used to treat bunions. So yes, essentially they are the same thing. What treatments are effective for mild or painless bunions? Mild or painless bunions, in general, the treatments for those things, shoe wear modification, stretching out your shoes, orthotics in the shoes, sometimes toe caps, anti-inflammatories, Advil, Aleve. Sometimes we prescribe anti-inflammatories, can all be very effective treatments for painless bunions. Can I still jog, hike, or lift weights after bunion surgery? Immediately after bunion surgery, I would not say you can jog. So day one, no, but once bunion surgery has progressed, yes. And it does not matter what type of bunion surgery we do. So if we fuse your big toe, for example, a lot of people are worried about hearing, oh, my big toe is going to be fused, it's not going to move anymore. There's a couple of good papers out there and in the literature that suggest that people's activity level actually goes up after bunion surgery, not down. There are, particularly after fusion surgery. And it's because their big toe doesn't hurt anymore. And so, yes, you can jog, you can hike, you can lift weights, you can do all of those things after you are fully recovered from the bunion surgery. In the recovery process, obviously, I wouldn't do a bunch of things that stress your foot while you're in the first few weeks after surgery. Do all bunions need surgery? Short answer is no, they do not. So if you have a painless bunion and you just have a deformity, you do not need surgery. I would not recommend surgery. If my foot didn't hurt and it just had a bump on it and I could wear a wide shoe and I was painless and did all the things I wanted to do, I would not have surgery. So no, they do not. How do you know if it's finally time to have surgery? That's a good question. It's really subjective. So it depends on the type of person. So it has to bother you enough to want to go through the recovery process. And so that's the thing that we'll talk about in the office. So if you are hurting, if it's been bothering you, if you've tried these conservative measures where you've done, shoe modification, medicines, all these types of things, and you're still frustrated, you're still hurting, you can't do what you want to do, your activities are modified and you're not happy with your quality of life, then it's time to consider doing something for your bunion. What dictates if you are a surgery or a candidate for bunion surgery or Lapiplasty? So it's essentially the same discussion that we would have about having your bunion fixed. So if you were saying, hey, I'm coming into the office and I have a bunion and it's been bothering me and I'm in pain and I need a forefoot procedure, the big thing we look at for doing a Lapiplasty or a Lapidus procedure is what we call first TMT instability or tarsometatarsal joint instability. That's associated with needing a fusion of that joint or the tarsometatarsal joint, which, like I said, is a joint above the metatarsophalangeal joint, which is the toe joint. So the joint above that, if it's unstable, then we'll talk about doing a Lapiplasty or a Lapidus procedure. Maybe not necessarily a Lapiplasty, but a Lapidus type procedure. If you don't have instability of that joint, then I wouldn't necessarily recommend doing a Lapidus type procedure or a Lapiplasty. So it just kind of depends on your specific symptoms, which is something that we would talk about after the physical exam, and we'd assess your motion and your instability and what type of bunion you have. Can you do both feet in one surgery? The short answer is you could, but I would not recommend it. And the reason I wouldn't recommend it is because you want one foot to stand on while you're transferring, one foot to do, it'd be hard to walk on both heels at the same time. And so we usually stage them out. We can do them relatively quickly after one another, usually within about 3 months is the kind of time frame where we would do one and then do the other. So while you're recovering from the first one, once you start heel toe walking on the first shoe and the first foot, we can transition you and start scheduling your second one if you're doing well. Are there foot exercises that can help? What do you think of toe spacers like correct toes? There are foot exercises that can help in terms of getting you to have good strength or arch support or help with the pain in your foot, particularly stretching your calf muscles. Those can all help with kind of forefoot pain if you're having forefoot pain. Toe spacers are fine if you want to wear them as inside your shoe to help keep your toes separated and things like that. That can be a symptomatic treatment. So you can use those things as a conservative measure. A lot of people use them and say, I don't have any pain. It helps my calluses. This is an easy way to go. I would lump that in kind of with the orthotics or with the shoe inserts or changing your shoes. They can all be effective. And so they're all worth trying. All those types of devices are worth trying before you have bunion surgery if you're having a symptomatic bunion. Do you actually cut the bone off and shave the bone? Yes. So when you develop a bunion, as time goes on, that we call it the medial eminence, or the inside part of that big toe that gets big and a prominent bump, it actually hypertrophies or grows. And so when we cut and shift the bone, we will shave off some of that bump to decrease the width of the foot. Is there joint replacement surgery for the big toe? Yes, there is. There is toe replacement surgery that you can do. It is sometimes an okay thing to do. It's not something that I recommend very frequently. The reason I don't recommend it frequently is because if you have a complication from a joint replacement of a big toe, the subsequent surgeries are very extensive and very complicated. And so there's a lot of literature and a high complication rate associated with joint replacement surgery of the big toe. And it's just the mechanics of the big toe, which we could have a very long conversation about how the big toe is shaped and the forces that have come across that joint. But joint replacement surgery for the big toe is available, but it's not very common and not routinely recommended. That's all we got today. So I appreciate y'all coming. If there's any other questions or anything like that, we can address those in the office. But I want to thank you guys for coming to this month's live webinar. A replay of this will be posted on our social media channels. And I want to say thank you all and good night.